our next speaker is Kate Hall. Hello, Kate. Kate's
Morning.
part of the MTF board, and she's also a very, very busy member of BAPEN. So it's really lucky that Kate works across both the organisations, which helps to bring us together, particularly around UK Malnutrition Awareness Week. So Kate's going to talk about some polling that we did earlier on in the year. And, we were a bit surprised about the results, but Kate's going to share that with you now. So over to you, Kate.
Thank you, Leslie, and thank you, Diane, for the introduction to today and also the week. As was mentioned, it is very much about being all in this together. And today being also sort of the focus for screening for malnutrition, whether that be for somebody who you know and having a conversation just to see if you think that there's any advice that can be given to that individual if they're having some difficulty in getting food, whether that's going out to the shops, just not having much of an appetite, or from a healthcare professional point of view, healthcare professionals out there. There's also the screening survey as well that starts today, and that's for inviting all professionals working in the health and social care sector to take part in the BAPEN screening survey. And all of that information is available on the Malnutrition Task Force website, all about UK MAW. But today I wanted to share with you, if my computer works, as Leslie said, we carried out a poll, the MTF carried out a poll earlier in the year in the summer, which just also demonstrates that we should never assume what we believe might be the picture is the picture. Now, bear with me. Just to say as well, just in the interim to fill the gap, that we also wanted to do a poll to really better understand what older people currently receive when it comes to oral health, what information they receive, but also what their concerns are and whether they see that it's something that they should be aware of or not necessarily be concerned about, but are they themselves taking it seriously from an oral health perspective? So that was the rationale behind why we wanted to do this poll and then see what came back as to, well, what role does the MTF have now next in helping support people in this area? Yes, what I wanted to talk about is really to share some highlights from the Malnutrition Task Force poll, and really because, which will explain, we shouldn't assume basically what we hear about in the press, that the issue around oral health is that people don't have access to a dentist and can't get to see a dentist, because what we found was slightly different to that. So what we want to talk about is something to get your teeth into. That's really sort of the theme of the presentation. Next slide, please. So what I'm going to cover off is why we did this. Why did we look at carrying out a poll looking at oral health, what we learned, and what we're going to take forward from this. So what's next? Next slide, please. So why did we look at this? Why did we look at this topic? Next slide, please. Well, we know about the causes and symptoms of malnutrition, but poor oral health is very much linked to a potential risk of malnutrition. So it's all interlinked. The impact of oral health on health and well-being is important. This is what we know. If we're not eating well, then it can affect how we feel from a mood point of view, and also just what we feel like we're able to do. Everything just seems to be much more of a struggle if we're not able to get enough nutrition into our body. And also, I know what it's like when if you have if your filling falls out of your teeth, you know, you're very much more sensitive to the temperature of the food, and it's a lot more difficult to chew on one particular side of the mouth. So therefore, it also impacts on the types of food that you eat, and even the foods that you do normally like, because you can't manage them easily, it's painful. Then it also takes the joy out of eating. So therefore, the food that's then going into your body, or the nutrition going into your body, isn't as good as it could be if you have anything going on with regards to from a teeth or oral health. And there is a really good overview in the reference that I've provided here around the link between oral health and sarcopenia and health. And again, it's that sort of bigger picture, of the domino effect of, if we're not able to eat certain foods because of either a lack of saliva, or because we can't chew things properly, or we just have a complete apathy around food, then there's less nutrition going into the body. So therefore, thinking around how that affects our nutritional status and our strength, and our sort of our muscle strength, as well as how we feel. So there is a very strong link between oral health and nutritional intake. And back in 2017, when I was looking to see what had been written around this, the Faculty of Dental Surgery at the Royal College of Surgeons particularly quoted that at that time, and bearing in mind that 6 years ago, 1.8 million people could have an urgent, this is people over age 65, 1.8 million people could have an urgent dental condition, such as dental pain and oral sepsis or extensive decay in untreated teeth. And by 2040, this number could increase by more than 50%. Now, just thinking about the knock-on effect of that, and because we're here and we're talking about, you know, risk of malnutrition and preventable malnutrition, you can see that, well, actually prevention is key. And if we can help support people to perhaps eat better or get improved nutrition and hydration, if they're not able to manage certain types of foods, then it will help improve sort of the risk of malnutrition. Next slide, please. So the contributing factors for poor oral health. Well, we know, we should be brushing our teeth twice a day, which is very simple. It's a simple piece of advice, but in practice, it's not quite so simple, because there's lots of things to take into consideration. For somebody being able to brush their teeth twice a day, they need to also have the dexterity to be able to physically brush their teeth. Remembering to brush, your teeth, and doing it for the right amount of time. I think it's supposed to be, and don't quote me on this because I'm sure I'll get it wrong, but 2 minutes, of brushing. But it's the act of brushing and how you brush your teeth is a certain technique to make sure that you're brushing them correctly. Side effects of medication. We know that some medications can make your mouth feel more dry, which can then affect your oral health. And also medications can link to there being less saliva in the mouth, and if there's less saliva in the mouth, it can make it more hard to eat. And even with dentures, I just always remember that dentures being sort of a big thing. Oh, it's because they've forgotten to put their dentures in, or because they haven't cleaned their dentures, that's why they're not eating so well. It's not quite as straightforward as that. And actually what we found in the poll, which we'll come on to, is not as many people as is perhaps perceived have dentures or needing dentures, but when people do have dentures, and I know with some of my patients, it's not so much that they haven't got the dentures, it's just more that they're not quite fitting in the same way, and if they've lost some weight, then the dentures don't fit in the same way, and they put their dentures in, but it's not fitting, and then they can't eat the foods that they feel they can eat, so they lose their enjoyment of eating, and they don't want to put their dentures in, but yet they also don't want to tell the dentist that the dentures don't fit anymore. And it's just the discomfort of wearing sometimes dentures can cause further problems and issues with what they can manage orally. Next slide, please. What's out there from a point of view of guidance? Well, there's the NICE guidance, which came out in 2017, for care homes. So there's the NICE Guidance 48 and the associated quality standards that fall out of that. And they make the recommendations that all adults who move into care home should have their mouth care needs assessed on admission. And that this is recorded in their personal care plan. And that adults living in care homes are supported, and supported will depend on an individual to individual basis what kind of support they need, but they're supported to clean their teeth twice a day and to carry out daily care for their dentures. Next slide, please. In addition, there is when I was looking to see from a domiciliary care perspective what support is out there for domiciliary care staff in supporting people with oral health care, there is some guidance out there as well. But the Royal College of Surgeons Faculty of Dental Surgery report from 2017, they're very much talking around prevention. Like we talk about from a malnutrition in older people, we're talking about what can we do to help prevent preventable malnutrition. They're talking about preventative advice is very much the key thing to provide. So to maintain good oral health before it becomes a problem. And so what we wanted to look at is, well, actually what's happening now, what information is going out to older people, what advice do they have access to help them maintain good oral health. Next slide, please. Because what we see out in the news is very much sort of, oh, there aren't enough dentists out there, people don't have access to get to the dentist. And we wanted to better understand that, the kind of bigger picture and what else is going on with older people. Are they even aware that they, of how to look after their oral health? So what we wanted to know is the current situation. And back in July, we carried out a poll to try to better understand what people think about oral health. We laid out 15 questions. Now, 15 questions don't sound a lot, but we did have sub-questions within those 15 questions. So there were a lot of questions to help us better understand also how people were living, whether they're living on their own, with other people, whether also they do their own shopping, and how often, as well as thinking about the types of foods that they're eating and whether their food intake has changed in 1 year, 2 years, 5 years. And we also split it into different age groups, because we know that sometimes it differs depending on what age group you sit within, and the geographical split. Again, but this is looking purely at England, but it was very much looking at the geographical split, because again, it could differ. We know that what information might go out to people in the northeast might be very different to the information that people have access to in the southeast, for example, and also looking at social background as well, just to look at the data in lots of different ways when it comes back. We did get feedback from 1,400 people. We did this in conjunction with Cantor Health, and the people that responded were aged 50 years plus, but we split the age categories accordingly. And what it did provide us with was really insights, is what we were saying, insights of older people's interest and attitude towards oral health and its importance. Next slide, please. So what we learned. Thank you. So the results of the poll suggested that more awareness is needed. It's that age-old more awareness needed, but also the so what factor. But why should people take more of an interest in their oral health, and what is the link between that and risk of malnutrition? What we did find is that older people generally think of oral health as being important, so that was good, that's positive. So 87%, that was good. But when it comes to the link between oral health and well-being, there was lower awareness. So only 2 in 5 people felt that there was a link between oral health and well-being. So i.e. 3 in 5 did not if that makes sense. So what this did suggest is that more awareness is needed to help people to understand the relevance of the link and what preventative action could be taken. Next slide, please. So this slide here summarizes sort of some of the statistics. Now, it's lots of words. I was trying to think about how I could make it more visual, and it was very hard without it, you needing your sort of a microscope to try to look at the quotes. But 1 in 3 people had oral health or mouth care information in the past month. So I'm not sure if that's good or is that bad. If you flip it around the other way, 2 in 3 did not have any information. Now, the way that they received that information was multitude. So it was when they had been to, they had a healthcare appointment, and it was most likely just an information kind of sheet. 2 in 3 people aged over 71 or more had 1 or more teeth removed. So if you think about the people, as you get older, then the types of food is clearly going to change as to what you can manage, and the textures of those foods, and therefore what's easy. So the nutritional content will inevitably be affected. 1 in 4 people over 71 years have dentures, which we felt was lower than we thought it would have been. And about 16% of those aged between 65 to 70 years. Dental caries, was greater in those 55 years and over. So once you reach the 55 years, then you're more at risk of dental caries, which again, if left untreated, what could that lead to? But it will certainly affect the food intake and drink intake, particularly because of temperatures, if you think about temperatures of foods. 1 in 4 said that they had noticed a change in what they can eat. So about 25% noticed a change in what they can eat over the past year or more. And in particular, a lot of them were saying that they felt that they were eating a smaller amount compared to what they previously been eating. And just as an interesting statistics, which then has led us on to think that more could be done here, is that 84% of people who responded did their own shopping all of the time, which is quite a high number. So it's reflective of people being more independent, but that doesn't mean to say that they are able to get the food easily in the right format or the right types of food when they do go shopping. But 11% saying that they needed some form of support, and that increased as people got older. Next slide, please. So what next? So just me reading out all of those statistics. What does that actually mean? What's the relevance? What that seemed to suggest is that the need for the creation of resources to raise awareness. Now, we know that different people in different parts of the country, there will be much more support, perhaps in some areas than in other areas, but we know that geographically across the board that there are services being cut and information available access-wise physically, apart from the internet, is becoming more scarce. So we know that older people are at increased risk of malnutrition and poor oral health. And what the insights seem to suggest is that from a dental perspective, that people are more likely to have some form of, whether it's some missing teeth or changes in food intake as they get older. So what we concluded is that what might be helpful is to create information for people who older people might come into contact with. So some simple tips, just a one sheet, simple tips for people who are working in domiciliary care homes or hospitals, in order to further help support older people with their oral health and nutrition, and why, and the strong link between oral health and nutritional intake. Some simple tips also for older people or carers or family carers, so that they're able to feel more confident around oral health and how to either best support their loved one or friend, or for the person themselves, how they can take more control, and at what point to be concerned. So it is about raising awareness to improve confidence. Next slide, please. In addition, maybe a simple sheet, sort of top tips to help older people with menu planning for shopping for food. So thinking about when going shopping for food, you know, when's the best time of day to go shopping for food, thinking of budget, because we know that some shops, some supermarkets, they tend to put sort of reduced items at certain times of the day. It might be quieter times of the day that people go shopping, where it might be easier and people might feel more comfortable shopping at that time. It might also be that there are certain days that some supermarkets, we do know, offer sort of certain times when it's quieter for older people to go shopping. There might be certain days that there are going to be more deals on foods. But also to remember, you know, tips like remembering to check what storage capabilities somebody has within their own house from a fridge or freezer or cupboard space point of view, just to be able to help reduce perhaps the food potential waste, but also to maximize the best kind of shopping. So you're only shopping for what you need, but also that the plate of food that is then provided at home is well balanced. And also some simple tips just to help guide older people so they know what support is available when shopping, because we know that there are some guided shopping available in some areas. There are some charities provide some support with carrying shopping home, or some supermarkets also offer discounted or maybe free deliveries, so that it's providing further support for older people. So it's a kind of you can do, if you want to go shopping and do your own shopping and be self-sufficient, there are ways to do that, whether or not you're able to move out of the house or flat or not. So it is all around raising awareness and improving confidence of not just older people, but also for the professionals and the non-professionals who are involved in supporting older people, so that what goes into the body is more balanced and helps support individuals' sort of health and well-being, but also maintaining good oral health. Next slide, I think that's it. Thank you. So it was just a sort of generated discussion really amongst ourselves within the MTF about what tools and resources could we put together that would be appropriate for the MTF to put together for older people and those involved in older people's care, to help further support good oral health, which of course then will help support improved nutritional intake for those individuals. Thank you.
Oh, thanks for that, Kate. And anybody got any questions? If you've got a question, do put it in the chat and we'll try to answer it. I think this was a really good presentation, because it made us both think about, you know, some of the things that we might not be thinking about when we're looking after people, thinking about our residents and patients. And I think it's really good for us all to ask ourselves, you know, what is the so what factor here? I think we're quite good at making assumptions about why people are not managing and what's happening. So it's always good to get that information. So thank you, Kate.